Today I'm going to be talking about aphasia. So, what is aphasia? Aphasia is an acquired communication disorder that impairs a person's ability to process language but does not affect their intelligence. This can be classified into two sections, non-fluent and fluent, most often caused by stroke, but also caused by brain tumors, traumatic brain injuries, and brain disorders. A person may have trouble talking, understanding, reading, and writing. Some more common characteristics into depth would be such things like word finding errors, saying a word related to the word you are looking for, word order problems, hard to produce full sentences, understanding non-efficiently, jokes are hard to understand, and reading and writing all over is typically hard, and also trouble with numbers as well. There are many different types of aphasia, some more severe than others and some different outcomes than others. These types include global aphasia, mixed transcortical aphasia, Broca's aphasia, transcortical motor, Wernicke's, transcortical sensory, conduction, and anomic. Defining these a little bit, global is a severe form of non-fluent aphasia caused by damage to the left side of the brain that affects receptive and expressive language skills needed for both written and oral language, as well as auditory and visual comprehension. Mixed transcortical is a result of damage that isolates the language areas from other brain regions. Broca's aphasia is caused by a lesion in Broca's area, which is a language region within the brain, characterized by misarticulated speech and lack of grammatical morphemes. Transcortical motor results from damage in the anterior, also in the superior frontal lobe of the language dominant hemisphere. So the language dominant hemisphere is the left, so the frontal would be the front part of the brain, and the anterior and superior part of that area. This damage is typically due to cerebrovascular accidents. Wernicke's aphasia is the ability to grasp the meaning of spoken words and sentences, but the ease of producing connected speech is not very affected. Transcortical sensory involves damage to specific areas of the temporal lobe of the brain, resulting in symptoms such as poor auditory comprehension. Conduction aphasia is a language impairment characterized by relatively fluent, although paraphasic, spontaneous speech. Anomic aphasia is a mild and fluent type of aphasia where an individual has a word retrieval failures and cannot express the words that they want to say. Some statistics about aphasia that can be found on aphasia.org. More people have aphasia than have many other common conditions such as cerebral palsy, multiple sclerosis, Parkinson's disease, or muscular dystrophy. Stroke is the leading cause of long-term disability. Stroke is the third leading cause of death in the USA and in Great Britain after heart disease and cancer. About 5 million people survive strokes in the United States. About 750,000 strokes occur each year in the United States. About 1/3 of the strokes result in aphasia, and there are at least 2 million people in the United States with aphasia, and there are at least 250,000 people in Great Britain with aphasia. Thank you.